So I'm originally from Baton Rouge, born and raised. I went to LSU for undergrad, and then I moved to New Orleans for medical school at LSU New Orleans. Loved it there, but I decided ultimately to come back to Baton Rouge for residency at Our Lady of the Lake Children's Hospital, where I trained for 3 years in pediatric residency. I decided to stick around for an extra year as chief resident and a faculty member, working with the residents in the hospital, in the nursery at Woman's, and at our pediatric academic clinic. And then finally, I came back to Baton Rouge Clinic, which is where I used to come as a child, and I bring my 2 children. So I have 2 kids. I'm a boy mom. My family obviously means everything to me, so I enjoy hanging out with them. We go on a lot of family walks, and I like to spend time outside. We get a little stir crazy inside with 2 very active children. So we spend a lot of family time outside around the LSU lakes, at the Kenilworth Park, those kind of fun things. Trying to get back into running after having my 2 kids, so that's something I also enjoy. I've always had a soft spot for pediatrics. There were a couple other specialties that I had interest in, but I always was drawn to the kids. I remember my OB rotation, you know, mom has the baby and I'm over by hanging out by the baby, you know, helping with resuscitation and those kind of things. So even on my other rotations, I noticed I really gravitated towards children. And I just really love my job. Like I tell people that nobody cares about themselves as much as they do their children. So that is really rewarding for me and why I do what I do. Being a mom, I can really relate to other moms and dads and those struggles that early parenting and late night feedings and tantrums. I can really relate to that because it's a big struggle, and kind of get on their level as to, okay, this is what's recommended, but this is also what really works as a parent. You need to be able to be honest and have very open and fluid conversations with your doctor. Overall, you know, we went through years of training in just pediatrics, taking care of all kinds of different ailments, whether that be in the hospital, in the NICU, in the academic setting, in the nursery even. So I think trust is really important, but also an open and an honest relationship with your pediatrician. If there's something that you're uncomfortable with or something that you have a question about, ask me. Send me a MyChart message, make a consultation visit. We can chat over the phone about it. We can chat in the office. So MyChart actually is such a blessing. I trained with MyChart and our whole Epic system, and I actually really like it. So it gives parents immediate access to, you might not get an answer within that minute, but you can immediately and directly send your doctor a message. So I check my in-basket with my nurses on a daily basis, and any urgent complaints or concerns we can address that day. And it makes it really easy for parents. You can even send pictures. I got a picture recently of, you know, is this normal for my child? Or what do you think about this rash? That kind of thing. Some things we can address over MyChart instantly, give you a call back or send you a message. Some things we're gonna ask you to come in so that we can take a closer look and do a full exam. But I think it's really about convenience, especially in this day and age. Parents need to feel comfortable to contact their physician directly and not have to wait hours or days for a phone call back. I was actually a patient of the Baton Rouge Clinic starting from birth until now. I still go here as an adult. And one of the biggest things that I like about it is the access to physician care. So most of us pediatricians, we work 4 to 5 days a week. Sometimes we have a half day in there, but we're here whenever you need us. We also are open for after hours during the week, and we have weekend hours as well, because kids get sick at all hours of the day and night. Sometimes it's at 3 a.m. and you need to call our nurse triage line, and we can put you through to one of our nurses and they can contact us if needed. We're on call 24/7 really. So I think that is one of the biggest perks about Baton Rouge Clinic. It's just kind of all-encompassing, and convenience and good evidence-based patient care is kind of our motto.